I think there's lots of bright new treatments on the horizon for bladder cancer. Probably the most exciting of all is the use of immunotherapy for the treatment of bladder cancer. We're seeing some very impressive results to immunotherapy. And we know from BCG studies that bladder cancer is very responsive to immunotherapy. And I'm hoping in the long term that our immunotherapy gets so good that we can melt away bladder cancer without having to do major surgery to treat it. Having said that, in the shorter term, our ability to do surgery, particularly major surgery like cystectomy, is improving quite dramatically. The advent of robotic surgery has made the surgery minimally invasive. Patients recover from it a lot quicker, they're back at work a lot quicker, and functionally can lead very normal lives. So I think in the future there are lots of improvements that are on the horizon.
Well, you asked me what the future of surgery in bladder cancer is. Well, you know, it's a major operation. You're taking away an organ that's got a function, it's storing urine. If we could find better drugs and better targeted treatment like radiation, perhaps to reduce the amount of people who need to do surgery on. We have been talking about that for 25 to 30 years. You know, we're not there yet, and I don't think we're going to be there for a while. Surgery, therefore, has got to become less invasive. The use of robotic or minimally invasive surgery, less destructive, where possible, leave organs like the urethra, the sphincters, the prostate sometimes behind in younger men. Better recovery. I mean, the main danger of doing a cystectomy is actually the bowel operation you do to actually make the diversion, because if that leaks, that's life-threatening. So finding other ways of maybe artificially producing diversion or a reconstruction not using the patient's own intestine. And there have been attempts to do that with growing new bladders and growing artificial diversions over the last 20 years, but we've not really found anything that's routinely replaced the patient's own intestines. So less invasive surgery, better recovery, better maybe avoiding surgery in some people with other treatments, and if we carry on with surgery, avoiding the use of intestine, because that's where the danger comes for any of these operations, if that leaks or doesn't heal properly. All those things probably are a few years off, we're afraid, at the moment.